Good morning and thanks for waking up with us today. It's Monday morning, so you know what that means. It's a Medical Monday with Dr. Roman Nations from Nation's Best Family Healthcare. Dr. Nation, welcome back to the show.
Good morning, sir.
Now, we were talking about the holidays.
Yes.
And you know, there are some health considerations in the winter months and around the holiday season in particular that we really have to look out for. Myself, I tend to overeat, maybe drink a little too much. I mean, that is a no kidding health concern, isn't it?
I mean, depends on a number of factors, but their age plays a large role in it. Your underlying metabolism plays a big piece in that as well. Mm-hmm. So some people, particularly if they're younger, they can overeat and overdrink, and usually their system
and bounce back pretty well.
And yeah, and we've talked about that
before. But a mature man like me with the metabolism of a manatee would probably take a little longer.
Take a little bit, yeah,
to rebound from.
And what most people don't realize, I think, is just having all the extra family around, especially if they've got kids and grandkids and those kinds of things, as they bring all these other little bugs into the house. Yeah. Nobody washes their hands, and so the kids come around and they touch everything, and then they pass some whatever illness runs around, viral illnesses.
Christmas is about kids for the most part, and they're little germ carriers.
Yep, little petri dishes.
Yeah, little petri dishes running around the house. So. I guess you have to encourage your children to wash their hands frequently.
Yeah, kids and the adults too. So it all comes down to because they'll hold on to they'll grab the kid or something like that, and kids they'll touch their hands and things like that. Mm-hmm. So even if the kids are not washing their hands like you want them to, the adults can actually help prevent the spread by washing their own hands.
Before the show, I mentioned to you that there is something going around.
Yep.
And you said there's always something going around.
There is.
It just seems that in the wintertime, in the winter months, for some reason, you notice people being sick more often.
Most of that, I think, is because people are indoors more. So the viruses and things that go around are always there. Like in the fall, it tends to be the flu. In the winter, similar kinds of things. As you get towards the spring, you start to get into the AGE kind of stuff. Gastroenteritis. Stomach bugs, and that goes through all the way through the spring. So I mean, we see it every day, year round.
Yeah, there is a stomach bug going around. Yeah. That just anecdotally, I've got a handful of friends who've been down for the count with that thing.
Yeah. So realistically, from an organism perspective, there's always something going around, and hand washing is really the best way to try and prevent some of that. So
when we talk about health hazards, we always think about bugs. You think about getting some sickness or some virus or whatever.
Yeah. And Ebola is finally calming down.
Yeah, no more panic. What happened to Ebola? That was kind of...
It's still there.
It's still there
somewhere. It's just like all the other avian flu and H1N1 and pig flu, swine flu and all that. I mean, every year there's always something there that's some catastrophic disease that's going to end the world. Yeah. So, but it doesn't.
And a lot of times it's just, the news media speaks in hyperbole a lot of times, so there is a...
it's not new anymore. Okay, so Ebola must be dead. No, it's not dead. It's still there.
Yeah, disease of the week.
Yeah.
Let's see what's on this week on disease of the week. But we think about those things, those organic things that'll get you ill and sick. But drinking is actually a sickness, and it can be a hazard. And behavioral issues like drinking and driving, particularly around the holidays,
there's a lot of that.
Could be life-threatening.
Yeah. I mean, not just the illegal part of it that could, end your political career or whatever.
Or end your career no matter what you are.
From your job.
I know, just being both of us prior military.
Yeah.
That's a career ender.
Oh yeah.
One DUI, you're cooked. You're done. Not to mention all the damage that you would do to your fellow citizens on the street.
Yep. Yeah. Most people that have alcohol issues don't realize it's a problem, or two, the biggest mistake they make is they think, somebody's mentioned to them that they probably have a problem, and they think, no, I don't, and it's all denial, or they think, oh, I got control of it.
Or only had 2 drinks at the party. Yeah. And they've got a commercial, a PSA out there now that says, buzz driving is drunk driving. And people are like, I only had 1 drink, I'm good. I'm an accomplished drunk, I can do this.
Yeah.
But you
very,
have to be
very
careful.
Dangerous, very, very dangerous stuff. So
we got to run off to the local weather, but I'd like to talk more about that on the other side of this break. And the local weather brought to you by the West Pittman Law Firm, westpittmanlawfirm.com. Welcome back to the show. I'm here with Dr. Roman Nation from Nation's Best Family Healthcare, and we're talking about your health and what you can do to avoid the health pitfalls of the holiday season. How do you like that? Right on the way.
That's a
Health
good one.
pitfalls. And we talked about don't overdrink is probably the best thing you can tell people.
That's the most dangerous one. I mean, unless, if you have heart failure, there's an issue with overeating and the fluid retention that comes with that, because you put in too much salt in your body, and if your heart can't compensate for it, then you swell and you go into heart failure. There's a specific condition called holiday heart for those types of people.
Holiday heart?
Yeah.
Really?
For heart failure patients that overeat in the holidays, not paying attention to what they're putting in their system, and they end up getting into fluid overload and end up in the hospital for a few days.
And fluid overload, how does that present? Do you just get swollen ankles, or what all happens there?
It starts with swollen ankles, and then, but the worrisome stuff is when they have trouble breathing, or most significantly, they can't lay down at night because they feel like somebody's sitting on their chest, so they have to sit up.
Oh my, like the elephant man used to sleep, sitting up. Do you get fluid in your lungs?
Yeah.
Is that what it is?
Yeah, you actually end up with, and you can see it on an x-ray. Your lung tissue is there, and then at the bottom there's these fluid patches that start to build up.
Holy mackerel. So if you have a bad heart and you're overindulging during the holidays, so I guess you would have to, for someone like that, you'd have to restrict their diet, maybe even restrict their fluid intake?
It's more of the salt intake than the fluid.
Really?
Yeah.
Wow.
Yeah, because the salt is what gets absorbed, and then your body says, I need something to dilute this with, so it pulls the fluid with it, and that's what takes the fluid.
It's funny, when you talk about the holidays, and like, I say the holidays like Thanksgiving and Christmas. A lot of people think about, the pies and the treats and all that other stuff. But it's funny you should mention salt, because I don't have a sweet tooth, but I'm a salty dog.
Yep.
I mean, anything salty I love.
That's
pretzels
a
and
huge pitfall. And actually, we just had a patient yesterday who came in. We've had him on a good diet for the last 6 months, and this is the first year he hit it in the holidays, and he looked around and he's like, good God, this is all crap. And he says, all I ended up eating was like chicken and turkey and fish for the entire week, because everything else I would eat it and made me feel sick. And once you start eating healthy like that, actually your body does get upset when you try to feed it junk.
I know you've mentioned that before. You call it eating clean.
Yeah.
And when you try to eat that, I think there was even a video out there, or a special called Supersize It or something, or
Supersize Me. Yeah.
Supersize Me. Where a fella tried to live on fast food.
McDonald's.
Yeah, and it wasn't pretty.
Cholesterol issues and liver enzyme issues, and there was a lot of stuff about the statistics about how much weight he gained. I think he gained like 23 pounds in a month. But even McDonald's, they're offering healthy choices now. They are, and most places, if you look for it, you can find healthy choices even at fast food places. Go for the grilled chicken instead of the fried chicken. Go for the apple slices or the yogurt instead of the French fries. Go for water instead of soda, or even diet soda for that matter. Diet soda is not as bad as full sugared soda, but it's still not healthy for you.
Yeah, but a little bit, it's not going to hurt you. A little and every now and then you can break down,
everything
have a
comes down in
cheeseburger,
moderation. Yeah, exactly.
I
mean, so we focus a lot of that with folks with the the dietary program that we got, and the other providers work on making sure your blood pressure and stuff is not over medicated, but also not under medicated at the same time. So we keep a really close eye on our patients, trying to manage all those things and counsel them in the process of how to make smarter choices. Alcohol is probably the most dangerous one that people tend to ignore. Everybody knows about smoking is bad for you, so that's in the media, and we talk about it a lot. And people know that that's bad. I think one of the bigger overlooked ones is the alcohol intake.
Yeah, and even a little bit of alcohol can really change your perceptions.
Especially for people who have alcoholism histories, it's a very slippery slope. Once you open the door, one drink turns into two, and every alcoholic that has been through that will tell you that. It's like, well, yeah, I got stressed out, so I started drinking once, and then here I am again.
And that's got to be particularly trying for them during the holiday season, when perhaps everyone's drinking around them.
It depends. Once the ones that are truly healed and figured out that it's a problem, it's kind of like knowing that if you pick this up, you're going to shoot yourself in the foot. Yeah. And once you get to that idea straight in your head, it's just like anything else. You say, nope, not going to do that. It's kind of like the difference between brushing your teeth and pouring battery acid in your mouth. People wouldn't do the second, but they know that the other one is healthier. So, but the alcohol does have that problem with with people with alcoholism histories.
I guess the good tip is moderation.
Yes,
Common sense reigns once again. Dr. Roman Nation from Nation's Best Family Healthcare, thank you so much for coming on the show.
Thank you.
And have a Merry Christmas.
You too.
And we'll be right back.
Hi, this is David Lovett, and this is your Mad Hatter Minute. Today we're going to be talking about brake pads and brake systems on your car. The first question that I have to ask you is, how do you know when you need brakes? And typically, there's only two ways that you know you're going to need brakes. One, if you're driving and you apply your brakes and you get a vibration, most typically in the steering wheel. The steering wheel start vibrating, you know you got a problem. If you feel it in your seat, feel vibration back in your seat, you know you got a problem. Second way to know that you might have a brake problem is noise. You hear a squealing noise when you're pressing your brakes. What that is that the hardened metal on the back end of the brake pad is actually making contact to the rotor. And it's your sign, it's your signal to say, hey, there's something wrong, time to get it into a shop. Now, in a standard brake job, there are actually 4 different components that you typically look at. Many other components on a brake system, but on a standard brake job, you typically look at your brake hoses, your brake calipers, your brake pads, and your brake rotors. All right, the hoses provide the fluid to the caliper. The caliper closes the pads back onto the rotor. The pad has friction material that makes contact to the rotor, and that's what makes your vehicle stop. Now, what I have here is your standard brake pad. Your brake pad has a friction material on the front, and it has backing material on the back. It also has this little tab right here that when you get low with the friction material, it's going to make a squealing noise. If you let this friction material get down into the squealer tab, it's going to squeal like a pig, and it's going to start damaging your rotor. Get your car fixed immediately. If it goes too deep into that rotor, you're buying new rotors. And soon, a $100 brake job turns into $200, $300 real fast. Don't play around with your brakes. This has been David Lovett, and this has been your Mad Hatter Minute.
Welcome back to the show. I'm here with Dr. Aaron Shores from Spine and Neuro Pain Center. Did I get that right? Specialists. I'm so sorry. I get confused. There's too many words for me. But you are a specialist in spines and neuro pain, right?
Correct, absolutely.
And that's your area of expertise. And I can see that we've got a backbone, a little portion of skull, some hips, and apparently the leg bone is connected to the skull bone. But there's more to it than that, isn't there, Doctor?
There is, yes. Mm-hmm. But I think that old song is certainly true. You know, there's a term that we refer to called the kinetic chain, which is basically a more scientific way of saying that the shin bone's connected to the knee bone. But all of these segments in the spine, whether it be the cervical spine, the thoracic spine, lumbar spine, or sacral spine, all interact. So if you have an abnormality in one, it often can translate to other parts of the spine as well, which can be a diagnostic challenge and take a little bit more time than some folks would like to get their pain better.
This is obviously a pretty complex mechanical arrangement that we have here.
Correct.
With our spine and our skulls and our hips and all the other things that interconnect, and of course the wiring of it all. There are things that can go wrong.
Absolutely.
Here. And that's what you do for a living, is help people with that. For instance, my wife recently got into a car accident where she was rear-ended, and she got whiplash. What is whiplash? To the layman, we have no idea what that even would look like.
Sure. Well, whiplash is actually a constellation of different symptoms, but many folks complain of neck pain after some sort of a traumatic event. Usually an auto accident is probably the most common I see in my practice. And it can be a constellation of either muscle pain, there's some joints in the neck that can sometimes be a particular pain generator. The disc can sometimes do that, and then there's nerves and bone up there as well that can also be affected.
So it's not anything here that's really broken, but it may be something like soft tissue that's damaged from
soft tissue, and there's some joints in the neck. Now, if someone's first in an accident, they typically have an X-ray, or sometimes, if it's bad enough, a CAT scan to make sure there are no fractures or large displacements of the spine itself. But assuming all that is normal and the patient is still having persistent neck pain, which is quite common, then yes, oftentimes whiplash can be a combination of both soft tissue as well as some joints in the neck called facet joints, which are these joints actually right here that form little hinge joints on the back of the spine. And these joints oftentimes are not diagnosed as a painful condition on an X-ray or MRI. In fact, patients after an accident can have a normal MRI or X-ray and still have quite significant pain from those joints. And a common scenario I see with that is somebody who has a normal X-ray after an accident. They go to physical therapy, do some of the conservative things, or chiropractic care, and it feels good while they're getting adjusted, but before they get to the parking lot, it starts to come back again. And oftentimes we have to ask ourselves what else could be going on deep to the muscle. And in many instances, those joints can be a particular pain generator that require a particular avenue to diagnose and treat.
And it's amazing the distances and the tolerances here between these little joints. I mean, it really is quite complex. It's pretty amazing stuff. Now, what are some of the other things that could go wrong with your spine that you see often in your practice?
Sure. Well, a lot of times we see with folks who've had whiplash injuries, they also typically get headaches, which is quite common. Many times because those joints and some of the muscles can refer pain up to the head and be a particular problem, as well as refer pain down here to the mid-back and either the lower back, because when some of these structures here in the spine that are deep to the muscle get irritated, that the muscles that run along the spine go from the head to the rear end, and whether they're irritated on one side or the other, that oftentimes can refer pain up and down the spine and lead to other diagnostic challenges in other areas.
Oh, so there are, I know before we started the interview, we were talking off camera about pain generators along your spine. What are some of those?
Sure. The muscles are very common cause. A lot of people will report knots or different muscle sorenesses after an injury. Those facet joints, or those little hinge joints that we referenced earlier, those joints also go from the base of the skull all the way to the buttock, and also can be quite a significant pain generator. The discs here are right here as well, which is what oftentimes I think patients always feel that their problem is based on an appearance of an X-ray or CT or MRI, and that sometimes is true and sometimes is not true. The bones and ligaments that hold these joints together, which are not shown on this model, sometimes can get stretched or damaged and become a significant generator. And the nerves themselves can sometimes be pinched or aggravated. So, and the diagnostic challenge sometimes, and the frustration for patients, is many of these structures you can see here relative to my thumb are not very big, and all of these structures refer pain in the same spot. So sometimes it is, unfortunately, a trial and error process to determine which of these structures are the pain generator and require treatment, because an X-ray or MRI cannot always tell us that.
All those small, intricate things you have to deal with to make us feel better. Dr. Shores, thank you so much for coming on the show and getting us smart on the workings of our spine.
You're welcome. Thank you.
We'll see you next week. And we'll be right back after these messages. Welcome back to the show. I have Thomas Winterman here in the studio. He is a clinical counselor and the author of The Thrive Life. And if you haven't read this book, I recommend you get it. You'll live a better life. Thomas, there's a lot of good lessons we can get out of this book, and I know you've been coming on once a week and giving us a Thrive tip for the week, something to get us started on a Monday. So what's our Thrive tip for this week?
For this week, my tip is to be a scientist. When it comes to goal setting, so many times we see it as pass-fail, we see it as whether we succeed and we reach our goal or we completely fall short and fail. But what a scientist does, they make a hypothesis, they test it out, and whether it's proven or disproven, they've learned something. They see it as an experience where they've gained some sort of knowledge, they tweak the variables, they go back, and they try again.
So what you're saying in a subtle way is that it's okay to fail
a
little bit.
Absolutely. And actually, if I really want to turn that on its head and say there's no such thing as failure. Everything that you do is a learning experience in some way. If you gain some knowledge from what you've tried to do, then you've succeeded.
Yeah, well, that's what they say. The definition of insanity is doing the same thing over and over again, expecting a different result.
That's right.
But if you're a scientist, as you recommend, you tweak that formula a little bit. You do something a little different next time.
Just a little bit. That's
and how has that worked in your own life?
Oh, it's worked perfectly. It's worked great. There have been plenty of things that I've tried that haven't exactly worked out the way I wanted to the first time. And you don't necessarily have to figure out this big, huge problem. You just tweak little variables here and there until you get it right. That's right.
It's like eating an elephant. I mean, you have to do it one small bite at a time. You just can't swallow the whole thing at once.
That's
and
it.
You're not going to solve everything from Jump Street. You're going to run into problems. And that's just life, isn't it, Tom?
It absolutely is.
Okay, so succinctly, the Thrive tip is?
Be a scientist.
Be a scientist. And is there anything else we can take from that beside being a scientist to kind of stretch out your Thrive tip for another minute, because Jeff's holding up a sign?
Sure. You know, when there's always something to learn from goal setting. There's always something to learn from trying to be better. So we've got to get past this point of seeing things as pass or fail, like we're in school, like we're getting some kind of grade for what we do. Everything that you do in life, every strive that you make, every time you try to move forward, you're learning something. There can be something that's some sort of knowledge that's gained from that. So you're not
all parts of your life then.
That's it.
Academically, maybe even your personal relationships. If you're an athlete, I mean, they learn from their mistakes, even watching videos of their competitions. I mean, you look where you went wrong and just tweak it a little bit. So have a little more clinical outlook on things, I suppose.
That's it. And remember, it's a skill, not a talent, which means you're not going to be good at it right away. You're not going to get it right the first time. It's something you have to develop and learn to be better at over time.
Thomas Winterman, author of The Thrive Life, thank you for that Thrive Tip of the Week. And we'll see you next time.